Transplant hair is falling after growth, 5 months post-op. I did my hair transplant 5 months ago. After 3 months, my hair started growing very well, and the hair covered all the bald areas. 2 weeks ago, I noticed that the hair that grew started falling, and I have bald spots now. I did not find anyone who mentioned a similar situation in the forums. Is this normal, or am I losing the transplant hair? Thank you.
Thank you for your question. You submitted your question without a photo. You describe in your question that you're 5 months out after undergoing hair transplant, and you state that your observation has been that there was decent hair growth after 3 months, but then 5 months out, a lot of the hair that was transplanted has shed and you have bald spots. And you've been looking on forums and it appears that it's not a typical situation, so you're looking for some guidance. Well, in the absence of more details of your surgery and at least an image, I can give you some general understanding of what I think about when I hear a story like yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is regenerative medicine technology to help men and women with genetic pattern hair loss using material called acellular matrix and platelet-rich plasma, which actually was derived from work we did to help patients heal better after hair transplant. So it is certainly understandably distressing to see more of your scalp being revealed after a transplant when things appear to be going well. And it is a challenge from just hearing the story. What is an explanation for this? The questions that would arise for me are, was these transplants next to a lot of existing hair? Are you essentially experiencing something comparable to shock loss of your existing hair? Are you dealing with hair loss progression? Or is it that the grafts are certainly being compromised from whatever reason? Could it be? There are certainly a lot of possibilities, and it's actually too early to draw any conclusions. When you look at any hair transplant healing process, it is not unusual for people to look a lot worse before they look a lot better. Now, we certainly have experience, and I don't want to certainly frighten you, but we've had patients who underwent mega session transplant surgery and had lost 90% of their grafts. And there are a lot of variables that come into play. When we were doing a lot of transplants and we wanted to get better healing of the donor area, we wanted to get better outcomes and survivability of the hair grafts, we used something called platelet-rich plasma and acellular matrix. And what was a nice side effect, which we've ultimately resulted in developing a whole new system for the management of hair loss, is that thinning hairs became thicker. Now move the clock forward over the past 7 to 8 years, we're actually helping patients from around the world, men and women, with different levels of genetic pattern hair loss. In addition, we're actually helping men and women who have undergone transplant. And the window that appears to be the most impactful for patients who have had transplant is within the first 3 months. And so we've had patients come within that window, and from our experience doing transplants, we've seen the grafts healing sooner and growing faster, as well as existing thinning hair looking thicker. And I always tell the patients it actually makes your hair transplant surgeon look better because you actually have better coverage when you have two modalities, the grafts and the regeneration of thinning hairs. So that aside, you're now at this window where if you aren't taking any other drug like finasteride to help manage your hair loss, you have really no choice but to just wait. I think it's tough for patients to wait, but I think it's important that you continue communicating with your doctor about what you're going through. No one knows your scalp better than your doctor, the doctor who did your surgery. And a lot of times when someone comes who's concerned about their situation, even a microscopic examination can help a patient understand how things are going. But when there is a certain degree of shock loss early on and there's a window of hair not growing, it can certainly be very distressing. We've had patients who even looked worse at a year and then looked better at 18 months. And so there is a range, certainly, and it depends a lot on a lot of variables. The more advanced the hair loss, the more tenuous the situation is with existing hairs, and other variables such as which occur during surgery and surgical healing and the way a person heals, all impact the outcomes of hair transplant. It's no surprise that people in our specialty are continuously challenged to get the best outcomes when you're dealing with a wide range of variables that are some of which are intrinsically part of the genetic pattern of that individual patient, and some has to do with just the wound healing process. Generally speaking, most people who do hair transplant surgery do a very good job. If they're doing a lot of transplants, they've got their systems down and they have good technicians and good process. It's really about how that individual heals that often ultimately determines the success of the procedure. So if you aren't on a drug like finasteride, then it's worthwhile discussing this with your doctor, because at least that's something to manage progression. I would say that in a situation like yours, when people like you yourself come to our practice, I often say that I don't want to do any treatment with a treatment like hair regeneration until after 6 to 7 months or longer has transpired, because that window of the first 3 months is already behind you. And then I don't think that there is a significant impact that we can predictably, with reasonable certainty, have predictability about. So I just wait till the 1 year and beyond period so that the grafts have grown and you can look at what is the true inventory before helping patients with using regenerative medicine technology. So I hope that was helpful. I wish you the best of luck. Thank you for your question.